is Dr. Mehran Asgari. I'm a consultant cardiologist with a specialist interested in treating and managing POTS patients. POTS stands for Postural Orthostatic Tachycardia syndrome. So under normal circumstances, our body naturally tightens the blood vessels in the lower extremities, so their circulation carries on. But in cases of POTS, or in broader term dysautonomia, which is a disorder of autonomic nervous system, this mechanism doesn't work well. So basically we have pooling of blood in the lower extremities, our legs, and our heart struggles to run with the circulation. Basically, there is some sort of deprivation of oxygenation in the brain. This is why POTS patients approach us with myriad of symptoms, including dizziness, lightheadedness, feeling faint, palpitation, which is racing heart, and that's a natural reaction. Basically, the heart beats faster to get the blood back to be pushed up to the brain and deliver that oxygen. So that's what happens in POTS, and that's why, apart from the physical symptoms that the patients suffer from, there would be more impacts on their mental states, on their normal life, on their productivity, and so on. We have conducted several surveys, both in Scotland as well as the whole UK, and we know for a fact that there are not enough services to deal with POTS patients. We know for a fact that a huge number of patients are struggling to see a specialist. We know that they have to travel long distances, sometimes going all the way to London to see the specialist there. This is costly, it's not right for the local patients who are already troubled with their symptoms. They can't sometimes go to uni, they can't sometimes go to school. You can think about the huge impact, both physical and mental, long distance travel have on this patient. So in clinic and with a really dedicated staff, we decided to find a solution for this, and basically this is somewhere for the patients to go to. We can assure the patients that we listen to them. We do our best to get to the bottom of their condition. If the POTS is diagnosed, we work with them, hopefully with a team of experts who work around us to get them back to their normality. We all know that basically there is not a 100% cure for POTS, but we know early detection is important. Recognizing the patient's problem is important. Working with the patients, either it's a medical treatment or, most importantly, in my opinion, rehabilitation with exercise is key to get them back to their normality as soon as they like. Firstly, I advise our patients to go to their general practitioner, mention it in a nice communicative way that I think, well, basically these are my symptoms and I suspect that I may have POTS, and our clinic is will be accepting referrals from the general practitioners, let's say hospital consultants, specialists, and even some of our good physiotherapists are very good in picking up on POTS, and what we need is basically a formal referral letter with the clinical details, patient's past medical history. And what we can offer here is seeing the patients, assessing their symptoms, going through their basically symptoms and past medical history, and run a few tests to ascertain that this is POTS or not, because that's really critical. If this is not the diagnosis that we are certain about, then we can guide the patients towards other ways of investigation and basically some other overlapping conditions. But when we get to the bottom of it by ascertaining that this is POTS, then we will offer patient treatment and rehabilitation. You may ask what sort of tests we offer patients in clinic, and obviously nothing replaces the good, let's say, history taking and physical examination. It should happen in any medical clinic in the world, but some routine blood tests, ECG, 12-lead ECG or electrocardiogram, blood pressure monitoring. Mostly patients require 24-hour patient blood pressure monitoring, cardiopulmonary monitoring, which is a long ECG to basically correspond the patient's symptoms with what we see on the ECG. And in some cases, we may require ultrasound scan of the heart, which is echocardiogram. These are the basic tests that more likely to get us to the diagnosis. Obviously, in some, let's say, complex cases, or those who may suffer from other conditions, we may have some more complementary tests, but these are the investigations that we can offer the patients to get to the bottom of the